Good afternoon, everyone. I hope you can all hear me. I'm Jill Kagan with the ARCH National Respite Network and Resource Center. On behalf of the ARCH Sustainability Learning Collaborative, which is hosting the webinar today, I want to thank you all for joining today's webinar on state respite legislation. I do want to take just a minute to introduce Lori Stahlbaum. She is our relatively new federal project officer for the Lifespan Respite Care Program at the Administration for Community Living, and she has graciously agreed to provide some words of welcome. So Lori, welcome, and thank you so much for being with us today.
Good afternoon, everyone. My name is Lori Stahlbaum, S-T-A-L-B-A-U-M. I have recently transitioned to the Administration on Aging within ACL from our Center for Management and Budget, where I was a special assistant to a deputy administrator. I am now taking over the role of project officer for the Lifespan Respite Grant Programs, which used to be managed by Victoria Wright. I have been with AOA ACL since September 2001. This is my full federal career in the one agency. When I first came to AOA, I was a presidential management intern and did a variety of rotations. Then I landed in the opportunity to run our Alzheimer's disease grants to states program, which I did for 5.5 years, and that program targets hard-to-serve populations due to geographic location, limited English, cultural diversity, and etc., which was a real joy to me. I then had an opportunity to move into our business side of the agency and learn more about the processes and etc. I was there for 10.5 years, and now I'm really happy to be back on the AOA side, running this program. I'm also assisting with the Family Caregiver Advisory Council and the Supporting Grandparents Raising Grandchildren Advisory Council, which Greg Link is my supervisor, and I know you all know, most of you or all of you know Greg. But we'll be working with Jill and others to make sure that the Lifespan Respite and Respite are active pieces of the conversation. We have some really dynamic members to the advisory council, so I don't think we need to worry about that. And so I have been a project officer before. I'm a little rusty, in the sense that when I did this, there were no automated systems, but I have done trainings for staff on grant solutions, so let's hope I learned something along the way. I am available to help or answer questions or listen or discuss concerns or accomplishments anytime. I've always believed my job as project officer is to ensure grantees' success, and most important thing I want folks to know is that you are my priority. So my grant programs are my priority. I understand that people may not have my email. It's Lori, L-O-R-I, Stahlbaum, S-T-A-L-B-A-U-M, @acl.hhs.gov. My direct phone number is 202-795-7444. And I'm definitely the type of person that believes there are no small questions or no silly questions. If you ever have any kind of question or any kind of concern or want confirmation about something, please feel free to reach out to me, and I will very much look forward to working with you.
Thank you very much, Lori, and we all look forward to working with you as well. Those of you who are now watching the screen, you can see I have a slide up about the International Respite Conference. I just wanted to to quickly mention that. Um, I want to remind everyone, and for those of you who don't know yet, a registration for the International Respite Conference is now open. It's very important to note right now that early registration ends January 15th. That's a little bit earlier, prior to the conference than we usually end it. So I just wanted to make sure you all knew about that. We're very excited to be co-hosting the conference with the International Short Break Association, the University of Wisconsin School of Nursing, and the Respite Care Association of Wisconsin. And for those of you who submitted a proposal for a breakout session, especially if you're a Lifespan Respite grantee or State Respite Coalition, you will probably be hearing in the next couple of weeks about the acceptance of your proposal. Everyone else will be hearing hopefully by December 15th. As you probably know, the conference is going to be held at Monona Terrace in Madison, Wisconsin, June 16th through 18th, 2020. And you can access all of the information about the conference on the ISBA website that's listed on the slide. ARCH will also be hosting a Respite Research Summit on June 19th, the day after the conference. And everyone is invited to attend, but I do want to let you know that seating will be very limited. We're trying to keep it small because it will be partially a working and interactive meeting, and there is a small additional registration fee. And then finally, please, for those of you who are grantees and primary state respite coalition and other partners, please stay tuned for more information about the Lifespan Respite Grantee and Partner Learning Symposium that will be held on the day before the conference, June 16th. This meeting is by invitation only to Lifespan Respite grantees and partners. Next slide, please, Emily. As you all know, the topic for today's webinar is state respite legislation, advancing respite for family caregivers. I do hear from many of you who are eager to learn about state legislative initiatives for respite. And the fact is, the history of state respite coalition advocacy goes back probably more than 2 decades now. Several state respite coalitions were at the forefront with passage of state lifespan respite legislation beginning in 1997 in Oregon, followed soon thereafter by Nebraska and Wisconsin, and later Arizona and Texas. And all of these bills became the foundation for development of the federal Lifespan Respite Care Act. Now, over the years, other state coalitions like those in Alabama, Illinois, Tennessee, were able to secure state funding from one or more state agencies to support their respite voucher programs. And most recently, some state respite coalitions in Colorado, South Carolina, and probably a few others that I may not even be aware of, have worked very successfully with their state legislatures to develop new line items for respite in their state budgets. And then there are states like longtime lifespan states like Nebraska and Wisconsin that have worked hard to maintain, or as just happened in Wisconsin, actually increase existing state funding streams for their state-funded lifespan respite programs. And this slide lists just a few of the ARCH resources that have more information, including a link to the grantee and partner networking website where we posted the original state lifespan respite bills. I do want to, well, let's just move on to the next slide, please, and I'll introduce our speakers today. I feel really so fortunate to have the presenters that we have with us today, who are really experts working in the state policy arena. The first speaker is John Bartholomew, who is the Senior Legislative Representative with AARP's Government Relations, and he's going to be discussing AARP's initiative to advance state support for respite through their Relief Act that would use Medicaid waivers to expand respite to more family caregivers. And our second speaker is Kathy Mayfield Smith. Many of you know Kathy quite well from our own Lifespan Respite Network. Kathy is president and co-founder of the South Carolina Respite Coalition. And they have, over the last several years, played a significant role in securing a line item for respite in their state budget. So she's going to be talking to us about that effort. And then we will be waiting to take questions after both presentations are made. But please feel free, as Emily said, to start typing your questions in the chat box, but we will wait until both presenters have completed their presentations. And then we hope we will hear from all of you who are representing state respite coalitions or respite programs or anyone else who has successfully advocated for state funding for respite. We'd love to hear about your successes as well as your challenges. So now let's begin with our first presenter. John, welcome so much, and thank you again for your time to do this.
Oh, thank you very much for inviting me to be part of this. This is an issue that's near and dear to my heart. I started with the Alzheimer's Association about 8 years ago, doing advocacy work for them, and learned very quickly the value of respite for family caregivers. In fact, it was a neurologist in Medford, Oregon, who said all too often he sees people, the caregivers, die of stress-related ailments before the person they're caring for with Alzheimer's. And of course, I've got some family caregiving in my family, so I want to make sure that everybody has the respite they need. My role now is I help 11 states deal with legislative policy, advocacy on healthcare and family caregiving issues. Prior to that, I worked in the state of Oregon doing all of AARP Oregon's legislative activities, and that's some of what I'll be talking about today. So make sure I can move the screen. Okay, there we go. Now it's working. All right, good. So first I want to just give a little bit of context about AARP's work on family caregiving, because we work both at the state and national level to support family caregivers. And I just wanted to put up a slide of some of the different things that we work on in states, from workplace flexibility, guardianship, telehealth, the CARE Act, which is making sure that there's good transitions of care from hospital to home. And we do this, we found that it's very synergistic. When you raise the profile of family caregivers and pass a particular bill, it often makes it easier to pass other measures within the state. These are not in competition with each other at all. And I know this audience knows this quite well, so, but the reason that we're doing this is that we have an older population growth in the United States. We can see that the climb in the 85 plus population is rapidly growing. And it's for great reasons. I mean, advances in modern science, but it brings a lot of challenges. And one of those challenges is ensuring care for older people who need it with fewer and fewer natural supports. There's an increased need in long-term supports and services. Obviously, older people are not the only people who need LTSS, but they're the primary users because of functional disability increasing with advanced age. And we don't talk about it as a society either. So there's a lot of people who are not really planning for it as well. But looking at this high likelihood of needing LTSS, the issue quickly becomes a personal one, not just a societal one. And more than half of us are going to be needing some kind of services. But mostly we talk about the formal programs like Medicaid and locations like nursing homes, but family caregivers don't get nearly as much attention, even though they are the vast majority of how people receive care in their homes. I mean, family caregivers do everything from, just helping people live independently at home. things like bathing and dressing, administering medicine, managing finances. Um, it's hard to overstate the importance of family caregivers. In fact, even so, as you see on this chart, over 90% of people who receive some kind of care are receiving at least some of it from family and friends. So we know that we need to shine a light on these caregivers to better support what they do. And I want to note that there's a real value to this as well. Now, so this is data from 4 years ago. And unfortunately, we have a brand new version of this report, Valuing the Invaluable, coming out in 2 days. But I'm not allowed to use any of that data for today because it's been embargoed. So what I would just encourage you to do is keep your eyes peeled for some news from AARP. I'd say follow AARP advocates on Twitter or something like that if you're not on our list otherwise. But there will be a new report coming out just in a couple of days. But the point is that family caregivers, the value of what they do is huge. I mean, the estimated value annually is $470 billion, which is more than Walmart's annual sales worldwide. Well, almost as much as Walmart's annual sales. And imagine if we were asking the Medicaid system to pay for all of this. It's just, although it's already a pretty significant amount that Medicaid is paying in terms of total expenditures. And one of the other key concerns that we have is that there's a declining ratio of natural supports to the people who need support. And so we're very concerned about this problem, and that's why we need to make sure that we support our family caregivers as best we possibly can. Now, caregiving can be exceedingly hard. And even though many family caregivers report they get significant emotional and spiritual rewards from their caregiving experience, which is something I'm going to say about my personal life. I've become closer to my loved ones as I've been doing some caregiving. It breaks down some boundaries in our family. But there's also stress. I mean, I feel emotionally stressed, as 63% of people polled in this particular survey did. This is one snapshot from Alaska. We don't have national data on caregiver stress. What we do is we do a lot of state by state stressors. And this is a very indicative one. It doesn't really change much from state to state. But you can see from this chart, people being stressed emotionally, stressed physically, financially. All of these things lead to burnout. They lead to people not being able to afford to continue caregiving in the home because they have to leave work too much. So, and it just really starts to cascade when caregivers themselves suffer their own health problems, because then you can't really provide good quality care for your loved one if you're suffering as well. So we all agree we need to do a better job supporting family caregivers. So we asked them, what do you need? Number one was information about resources, which is something ADRCs typically provide these days, Aging and Disability Resource Centers or connections. And number two is they said they need a break. It's right up there at the top. And you all know, I don't have to explain what respite is to this group. But I would say when we asked, 85% of family caregivers say that respite would be very or somewhat helpful. So what are we going to do about that? It costs money to access respite. So AARP stepped back and we said, what can we do to make this more affordable for people, especially those who are likely to fall onto the Medicaid rolls? So we crafted this idea. and it's a Medicaid waiver proposal that we call Relief, Respite, RE, Living Independently, Energizing Families. Yes, it's an acronym that we kind of forced to happen, like most congressional bills. But because states have flexibility on proposing Medicaid 1115 waivers, we thought, let's try to put something together that would create a narrow benefit package as opposed to a full package of Medicaid services. And it would be respite care and care coordination for individuals with family caregivers. The eligibility for this would go up to 400% of poverty level, as opposed to the standard level that Medicaid sets. And we figured, okay, the state could then use a sliding scale to allow families at the higher end of the income scale buy into these services. But the key point here is that it would be something that would generate federal matching dollars, so that if a state said, okay, we will provide $2 million of funding, the goal would be to get another $2 million of funding from the federal government through the Medicaid program. That's the goal. Now, while no states have submitted for a relief waiver yet, we have seen multiple states have waivers approved that have individual elements of the relief concept, just not as a kind of a standalone thing. Minnesota, Rhode Island, Vermont, and Washington in particular have approved waivers that provide a limited package of HCBS to prevent or delay the need for higher cost of care later. And Oregon is the closest to crafting a standalone relief waiver, which I will get into in a moment. And as I noted, the goal here is to provide support to those a bit further up on the income scale as a way to prevent or delay those at risk of institutionalization from eventually needing full Medicaid benefits. And it could free up some money from other state-funded programs because it leverages the federal dollars. And so you could help some of the other supports for older adults in your states. As each state considers its next steps in Medicaid long-term supports and services, I just want you all to know that AARP state offices can help, can work with you to develop this possibility if you're interested in doing this in your state. As I mentioned, Oregon has moved the furthest towards creating a relief waiver. Well, how did we get here? So, the foundation for the Oregon effort was built in 2016 when a caregiver respite work group was formed. At the time, I was working in the AARP Oregon State Office, and I coordinated this effort. And we launched it at a summit in April that our keynote speaker was Jill Kagan. And so thank you, Jill, for helping get this whole project started. From there, so we had about 75 people show up at that. And from that, a group of about 20 individuals representing a broad group of stakeholders, private, public, nonprofit, individual caregivers, academics, all started working together to figure out how Oregon could increase the availability and use of respite in Oregon. So the work group reviewed research and literature on the topic, and very importantly, held 14 community meetings around Oregon that summer. These are really important because, first of all, what people say they need in Portland may be and was completely different from what they needed in Pendleton. For example, in Portland, they were concerned about the cost of respite, but in Pendleton, they didn't have any services. There was only one adult day services on the eastern side of the state. And second, it's useful for political purposes to be able to tell legislators that you were in their communities listening to their constituents. And we invited legislators to these meetings, and a number of them came and participated. So the work group published its report in November of 2016, and you can access it via this website any old time. It's still there. And as a result, the next step was in 2017, the legislature passed House Joint Memorial 4, which is mostly symbolic, but it put the recommendations of the work group in front of the legislators. And it also urged, had like the state saying, we, the Oregon legislature, urge Congress to pass the Raised Family Caregivers Act. So that was kind of nice. I'm going to briefly just show you the recommendations of the work group. I'm not going to go through this in the interest of time. You can access it because you can get the slides. You can download the slides for this. Ones in bold are ones where there's definitely been action taken since publishing the report. But there's a big focus on education and awareness, increasing the supply of providers, and even more of that. One of the more interesting ones is there is now a community college actively working on plans to set up an adult day center on campus, and 2 others in Oregon are considering doing something like that, which we think is very exciting. And then making respite more affordable. And so one of our recommendations was essentially the relief concept that we're talking about today. So now, since we need to get this relief concept moving forward, I would say one of the most important things that we did was that the State Department of Human Services was engaged in the work group process. And they love this idea of the relief model. So they submitted it last year to be part of the governor's recommended budget. However, it didn't make it into the governor's budget. So we at AARP partnered closely with the Alzheimer's Association to promote what's called a budget note, which would be, literally a note in the budget that would direct DHS to craft this waiver. But then when we took it to the co-chairs of the Ways and Means Committee, they said, oh no, you need a bill because this is more policy than we can do in a budget note. Okay, so we got a bill. We introduced a bill called Senate Bill 1035. We had a great hearing. We had many people come and testify in support: MS Society, Providence Health Systems, Leading Age, Oregon Association of Area Agencies on Aging and Disabilities, Oregon Healthcare Association, and many others, and nobody opposed it. It sailed through the policy committee unanimously and then sat in the Ways and Means Committee till the end of the session, at which point the co-chairs of Ways and Means then figured, oh no, we can do this as a budget note, and it was included in the DHS budget bill, which was passed and signed into law. So this now is essentially a law that they need to craft the relief waiver. So DHS has been informally meeting with stakeholders to craft a first draft of the waiver using the legislation and the Washington State waiver as the foundation for it. As I noted, the Washington State waiver, it's a piece of their big overall Medicaid waiver. A formal advisory group will be convened in December to finalize the proposal, and then legislators will have a chance to review it. It will go to the Centers for Medicare and Medicaid Services for approval. And we believe that the Ways and Means co-chairs are likely to fund this if it's approved by CMS, because that's conversations we had with them as they said, yeah, if you can get CMS to approve it, we will, likely put the state level funding towards it. So, we'll see when that happens, but it was definitely a positive conversation. They wouldn't have put it in the budget as a budget note if they weren't intending to support it. So I just want to say that support was really developed for this through that work group process. The state agency had buy-in, stakeholders had buy-in, legislators involved had buy-in. We didn't come out of the blue. I don't think this would have happened without the support from a lot of different organizations and people all involved in the process. Now, it does remain to be seen if CMS will approve the waiver, but we're very hopeful that they will. And if you're interested in pursuing similar legislation, contact AARP, and we're happy to help you out. So now I'm going to give control back, and I'm happy to answer questions at the end of our session. And thank you very much for your time.
Thank you, John. That was a really excellent and thought-provoking question, and I'm sure you're going to hear from a lot of people. Kathy, please go ahead and welcome.
Kathy, I think you need to unmute.
Yes, I do. Thank you very much, John. I am the board chair and co-founder of the South Carolina Respite Coalition. I've actually worked at the University of South Carolina in the disability field for most of my career. And for the last 15 years, I've been at the Institute for Families and Society, where I do evaluation and policy work with the Medicaid agency. And I'm also the parent of an adult child with autism, and provided care for both of my parents as they were aging prior to their passing. So respite has really been a part of my life for all of my adult life in one way or the other. And so the Respite Coalition particularly has been more of an avocation for me for the last 20 years. But it is the work with that coalition that in many ways I am most proud. So let me tell you a little bit about what we do. Although the South Carolina Respite Coalition has not yet pursued any state respite legislation, we've been very active with our legislature in many other ways. As a state respite coalition, excuse me, we are by definition an advocacy organization, and that includes legislative advocacy. We conduct a variety of activities. Okay, let's see. Actually, I think I put my slides out of order, so let me go into this. Okay, I guess the major success that we had in our state advocacy is really our the line item budget. We had an interesting event. Where our lieutenant governor actually resigned, and so the person who was actually the Speaker of the House of Representatives became the lieutenant governor. I apologize. I had an updated slide deck that I didn't send, so let me try to get this in order so that this will make sense. Our major tangible success in working with the legislature has really been this line item approval of a budget item in the lieutenant governor's specific budget. Our Office on Aging is actually out of the lieutenant governor's office in South Carolina. and they are also the Lifespan grantee in South Carolina. So in 2012, when Lieutenant Governor Glenn McConnell, who, as I mentioned, was the Speaker of the House, became the director of the Office on Aging, he really took this responsibility seriously. He and his wife had been caregivers for his mother, so he had some understanding about respite, but not nearly enough. So he decided really to get a better understanding of all of aging services. So he decided to take a tour of the state, calling it the Tour on Aging. He held 10 regional community forums in order to be able to hear directly from older adults and caregivers. And I think, like John talked about in terms of those regional meetings that they held, this was really critical to really understanding what the issues were, and I think laying the foundation for what happened afterwards. The Lifespan, as I said, our Lifespan grant runs through the Office on Aging, and so the director of that grant at the time was also a deputy in that office, and she actually went on the tour with the Lieutenant Governor. So this really gave her a unique opportunity to really reinforce comments that those participants came up with in related to respite. It also gave her an opportunity to really educate him about lifespan respite and what lifespan really meant, as well as efforts underway through those lifespan grants. As expected, respite was a major theme in all of those meetings. Between that and between the director's education, it had a major impact on the Lieutenant Governor. So in terms of the role of the state Respite Coalition in that effort, we made sure that our executive director or a board member or volunteer around the state also participated in all of those regional meetings. We provided education and data on respite, so there was some fact-based information being given, but we also notified our network of family caregivers around the state and encouraged them to really go to these meetings and tell their stories, because we all know that those are in many ways the most impactful information, particularly to someone who comes from the legislature or is really trying to serve a constituent group. So at the end of that tour, the Lieutenant Governor added 2 recurring line items. He had heard from constituents in the broader context of aging services. And so one of the requests that he put in that year was $3 million in additional supports for caregivers, similar to what aging services provide, meals, transportation, things like that. He never felt that they had enough money to really serve the aging population in South Carolina, so that was his first request. But his second request was another $3 million specifically for respite. The Lieutenant Governor, as I say, was a former Speaker of the House, so he really did the heavy lifting in the legislature to get support for the budget request, including bipartisan co-sponsors. And then the advocates, including the Respite Coalition, went to work providing information about respite, data supporting the need in South Carolina, and encouraging family caregivers to contact their legislators, again, to tell stories about how critical respite really is in their lives. One of our major strategies is really working with partners. It is really the foundation of Lifespan Respite in South Carolina. South Carolina's grants are built on partnerships between the Department of Aging, between our Respite Coalition, and between Family Connection. But we also have a state committee on respite, and we have regional committees. And through those committees, we bring additional state and local partners to help in terms of spreading the word about respite and in helping us to develop respite programs around the state. And then with regard to legislative activities, it brings more voices to be able to support any efforts in that arena. Since the beginning of our lifespan efforts in South Carolina, we've really been focused on coordinating respite service delivery. We work really hard to cooperate and support each other's efforts so that we're not fighting over the same pots of money, but we're actually working together to develop as many of those respite resources as possible and serve as many caregivers in South Carolina as we can. In this particular effort, we coordinated the message with our state AARP and with our state Alzheimer's Association. Like John mentioned, in Oregon, those are two of the stronger organizations in South Carolina, and particularly when it comes to legislative activity, they're wonderful partners in helping understand how to navigate that whole system. And so with them, we really worked to coordinate the message, and we developed a joint legislative statement describing respite in South Carolina from AARP and the Alzheimer's Association and the Respite Coalition. And the idea behind that was to really clarify for the legislature and make it as simple as possible so that they could understand what services were available and who some of the key organizations were that could respond to questions and provide information that they had. So developing and maintaining these partnerships, in our view, is really key to building those supports. One of our signature events in providing information and educating the South Carolina legislature is our Respite Awareness Day. And we certainly used it in supporting this line item budget. But what we do each year, the week of Valentine's Day, actually it's on the Wednesday of that week, we host our Respite Awareness Day. Our legislature is in session from January to June, and they're half a day on Tuesdays, a full day on Wednesday, and half a day on Thursday. So we always pick Wednesday because we know that they'll be in session on that day and be accessible to the public. We have the governor sign a proclamation. We invite all of the news media outlets and provide information for their calendars, and then also make people available for interviews if needed. We usually hold it in the rotunda of our Capitol building, which is between the governor and lieutenant governor's office. Sometimes we hold it on the front stairs, depending on the number of people that are there. But it's a good place to really be kind of in the center of that activity. And then we have advocates and caregivers and providers from around the state that are also invited. Several years back, we actually also started doing something at that Respite Awareness Day where we actually presented 2 awards to what we call Respite Champions. Some have been legislators, some have been agencies, some have been providers. All are people who have made an impact in the current year and in order to move respite forward. So we found that's been a good way to say thank you and really highlight some of the good work that's being done. And then we use this day also to actually have, selected family caregivers who come to Respite Awareness Day. These are people who've actually received vouchers, and we usually have one who represents caring for an older adult. We have someone who represents that younger adult age family member, and then parents of a child who've actually received vouchers, and they come and talk, tell about their story, and really talk about what a difference respite has made in their lives, in order to really, again, put a face to respite. And then after that, we have, we usually have the governor sign a proclamation for Respite Awareness Day for that day. And then we'll have a representative from the floor actually recognize the group during the session. And then that gives the caregivers an opportunity to also go and meet their own representatives and share their stories about their families and the struggles that they face, and how important respite is to them. And then we will provide written information. We usually have a fact sheet. We usually have a handout that's put together with additional faces of respite, where again, these are folks who have received vouchers from the voucher program, either from us or from one of the 10 AAAs or family caregiver support programs, and then and disseminate that to all of the legislators. Some of the additional advocacy work that we do is we've also used Respite Awareness Day to actually present documents to the legislature. As part of our Lifespan grant, we developed a state respite plan, and in 2013, that was actually presented to the legislature. We updated that in 2018 and also presented that to the legislature. Usually at that, either the lieutenant governor or the director on the Office on Aging is there to actually present the document, and then we make sure copies are given to all members of the legislature. Other kind of routine and targeted public awareness activities are just regular ways to get the word out, whether it's through our listservs or newsletter articles or Facebook or Twitter and some of those caregiver feature stories. But all of those lay the foundation for the more specific work. So we had a lot of that already in place from our history of actually providing information to the legislature when this budget line item came about. So we had laid that foundation, and then we're able to really pull everything together in order to take action at that time in order to provide support for the lieutenant governor's line item for the for that respite line item, which actually started our state respite program. So the back to that state-funded voucher program, the lieutenant governor put that request in for fiscal year 2014, and the legislature actually did approve the $3 million that the lieutenant governor requested. However, they only approved it for 1 year, so it was non-recurring. And then the lieutenant governor's office implemented the voucher program through their older, or only for older adults, through their family caregiver support program. Although Lieutenant McConnell had actually intended the funding to be across the lifespan, the director who was in the Office on Aging at that time really believed that because they were the Office on Aging, they could really only serve the population that they were already directed to serve. So in the beginning, our state voucher program really only served folks who were 60 and older. Some of the things that you find in this process, even though we were successful in getting the money, due to delays that year in the legislature releasing the money and the time that was required to implement the program in those 10 regional offices, the full $3 million, unfortunately, did not get spent that year. It did not get disseminated fully to families. And So since it was non-recurring, that really presented a challenge to not only the Lieutenant Governor's office, but advocates as well, in really, demonstrating the need, and not only trying to continue the same level of funding, but even to get the funding again in the next year's budget. Fortunately, though, in 2015, the line item was only reduced to $2 million, and we were successful in being able to make it recurring so that it would be in the Lieutenant Governor's office going forward. In 2016, the funding stayed at $2 million, but the Lieutenant Governor's office kind of broadened the voucher program to the full lifespan. And I think it's important at this time while it's important to advocate within the legislature, I think it's also important to advocate within those agencies. John mentioned in his presentation the importance of the support of DHS and other agencies that were involved. I think for us, the support of those agencies is critical. And in the Lieutenant Governor's office, it was important as Lieutenant Governors change, as directors change, that we are continually educating them and re-educating them, not necessarily about respite per se, but about the Respite Coalition, about lifespan respite, and about the importance between the partnership between the State Respite Coalition and the Office on Aging. I mean, that's critical, I think, in moving everything forward. So we continued to do that with our partners through the Lifespan Grant, and they advocated within their own department. And so in 2016, when they were able to continue the funding, they added the Respite Coalition as one of the partners in that network in order to provide respite vouchers to that younger population of younger adults and families who have children. So that in 2016, we were awarded $100,000 in voucher money. In 2017, we were able to advocate to get that line item increased to $2.4 million. In 2018, we were able to keep the line item at that $2.4 million level. But the Respite Coalition, because of our success in disseminating that money, was able to get another $100,000. So we now have $200,000 in voucher money of that $2.4 million to be able to disseminate to families with younger members in their family. And then in this year, the line item was maintained, and we've been maintained at that same level. I think since its approval in 2014, you can see that that this is really a process. Even with the successes, it's kind of like that never-ending battle. You've got to continue to really work with your legislature and advocate with all of the constituent groups to really help continue to show the need for respite for these families. In South Carolina, we're a relatively poor state, so there's always competing priorities in that budget. Any year that could get cut. Nothing can really be taken for granted. So from our perspective, our advocacy role is really twofold. One is it is really to spend the money and really make sure we're getting it in the hands of families in order to be able to continue to demonstrate that need to the legislature. And then we continue to provide information throughout the year, again, keeping that foundation solid in helping them understand the importance of respite, helping them understand the needs of caregivers as things change in South Carolina. It's important for them to understand how that impacts families. I think in South Carolina, we have nationally, I think it's 1 in 5 caregivers, or in South Carolina, it's 1 in every 4 people are caregivers. So caregiving with the aging population in this state, as well as folks with disabilities, is a need that we are really just now beginning to address. While $2.4 million sounds like a lot, it really does not go very far. So there's still a lot of work for us to do, but we were really pleased with the ability to at least begin addressing this on a lifespan scale and really helping to get the understanding of the need to address all populations and caregivers of all ages as part of that whole respite movement. I think, again, like I said, the biggest takeaway is really that it's an ongoing process, and that it's just something that we've got to continue to work on and continue to maintain the success we achieve, and then continue to build on that through all of our efforts and through all of those partnerships. I think that is the end of mine today.
Wonderful. Thank you so much, Kathy, and thank you, John, also. We are right at 4 o'clock, and I actually don't see any questions coming in right now, but I'm sure that our presenters would be willing to stay on another 5 minutes. John and Kathy, are you able to stay another 5 minutes if anyone wants to ask a question?
Absolutely.
Okay.
Yes, for sure.
Does anyone, if you would like to ask a question, you can raise your hand or unmute your phone and ask it, or type it into the chat box. Any questions? There's one coming in now from Kathy Miller. She'd like to know, is the South Carolina Respite Coalition a 501c3?
Yes, it is.
That can certainly help with some of the activities.
Yes, it does.
Undertaken. Any other questions from anyone? John, maybe you can quickly remind everyone if they'd like to pursue something similar to what's happened in Oregon or Washington, specifically Oregon, because that's so focused on the respite piece. How would they be in touch with you? Just through your email address, and you're the correct person they should reach out to move forward?
You can easily reach out to me. I have 4 other colleagues that help another like 11 or so states or territories. We divvy it up. And so if somebody sends something to me saying, hey, I'm here in Florida and I'd like to work on a respite waiver like relief, I can put you in touch with my colleague who then can work with you on that. Great. And if you're already in touch with the AARP state office, then you can do it that way as well.
Wonderful. We are getting a couple of questions from Leanna Crescent. She'd like to know if the South Carolina Respite Coalition provides respite care to kinship caregivers for children in foster care.
Actually, not yet. The guidelines for how we disseminate this, actually, I take that back. Through the state voucher program, we would not, but we actually have money through our Lifespan grant as well. That's a part of that voucher program. And so through that mechanism, we would be able to. But that's interesting that you raised that, because we just had that conversation with, there's new leadership at the Department on Aging, and that was one of the things that actually came up in that conversation.
Great, helpful. Another question from Cheryl Donnell. She'd like to know how many families can be served with respite for the funding you're receiving. And I'm assuming she's talking about the 200,000 in the line item.
Yeah, not as many as you think. What we do is our guidelines really start with $500 for the voucher. Part of that is to encourage folks to actually use the money, because a lot of times they'll get approved for the voucher and not use it. But we've recently changed those policies and can actually go up to 1,500s in increments of 500 as they use it. But with $500 and $200,000, that's really only about 400 people. So it's with our 200,000, it's really not that many families. Even with the 2.4 million, it's not that many. When you start dividing the numbers, that's why I said, while it sounds like a lot of money, it really is just a drop in the bucket.
Are there ongoing efforts to try to raise the 200,000 to something that's more proportional to the 2.4 million?
Well, yes and no. I mean, part of it again is demonstrating. We actually have had to increase our capacity because we only had, a half-time person, and so when they gave us the additional 100,000, we had to increase the capacity. And so I think if we get to a point where we're running out of money, say in the spring, then there might be a way. Usually they'll come out in January. The Office on Aging will come out and say, how is everybody spending? Do you need additional funds? And then they'll disseminate the remaining funds. And so we have been included in that pool this year. So depending on how our spending is by January and what we project to spend next year, then we could tap into that. But they don't really think about it in the terms of, I guess, the balance of the population. They're looking at the 10 other regions that they have, and I mean, we still have. They could easily justify still just providing it to the aging population just based on the numbers. But I think that's our best approach, is really just disseminating the money and getting it out in the hands of families and justifying that need. Then I think we would be able to advocate for additional funds for the younger population.
Right, thank you. There's one more question from Lita Nelson. She'd like to know, are your family caregivers case managed? And I assume that's for Kathy again.
Yeah, those who come through us are not. One of the things that we do with every voucher recipient is when we receive the application, we do make a phone call to them and speak to everyone, and most of that is really spent on educating them about respite, asking them how they plan to use it, make sure they're actually using it to get a break, and helping them to understand the importance of that. And then if they needed, if their family member was not already connected to someone, to a case management agency, then we would refer them to an appropriate organization to do that. But we actually do not provide case management for this. And since it's vouchers, it really is, they're selecting whether they use an agency or whether they use an individual. But we will provide a lot of information on how to interview, how to recruit, those kinds of things. But no, we do not provide case management.
Okay, there's one more question, and then we'll probably end the webinar because we're 10 minutes over. But there's a question from Daphne for John. And she'd like to know what specific services other than respite care were included in the draft of the waiver.
Okay, so I have it right in front of me. First of all, it would be services and supports totaling no more than $500 per month value. So it's in-home support services or personal care services, adult day services, respite services. Okay, so there's that. Emergency response systems, special medical equipment and supplies, supports for consumer direction, assistive technology, minor consumer home modifications, home delivered meals, transportation in conjunction with another service, and education and training for unpaid caregivers. So these are all what's proposed right now. What's interesting is that the state is already paying for education and training for family caregivers through just a pot of money that the state decided to do. Is called Oregon Care Partners. And so it's possible that stuff that's already being done, if you're somebody who wants to use that program, and then you also qualify within this waiver, then the state will get matching funds for what it's already doing.
Could you also tell us, John, before we close, where we can get more information about, you mentioned the Minnesota and the Washington waivers. I know they're broader than just respite, I think you mentioned.
Yeah. Where you can find more information about that, well, it's the kind of thing where I'd probably be digging around for a while. So,
okay, we could both do some research then.
Yeah, exactly. Maybe we'll do a follow-up about that.
Yeah, that would be great.
Okay.
I think we're going to close out now because we are about 10 minutes past the time I promised you that we would all end. So thank you again, both to John and to Kathy, for taking the time to do such excellent presentations today. And I'm sure we'll have a lot of follow-up questions after we conclude. For those of you who are on the call, before we hang up, I just want to remind you to please respond to an email that you should have in your inboxes already, asking for feedback about today's webinar, and to also give us any suggestions you have for future topics. We really appreciate it if you could just take a minute to do that. So again, thank you to Emily for helping to monitor the webinar, and thank you to Kathy, and thank you to John, and thank you to all of you who spent your afternoon with us. And you'll be hearing from us soon with the recording of today's webinar, as well as I'll make sure that you have the slides as well. If you want to download the slides right now before we end the meeting, if you scroll up on the chat box, you can see a gray box that says download. So I'll stay open for another minute in case you would like to download today's slides. Thank you, everyone, and have a wonderful rest of your afternoon.
Thank you, Jill.
Thank you.
Thank you.